Close to 4,000 new nurses are expected to be progressively brought on board by the end of next year as part of measures to replace talent that was lost during the pandemic. Health Minister Ong Ye Kung shared this at an awards ceremony today, calling the number significant as it makes up about 10% of the current nursing workforce.
A long wait for admission to hospitals may soon be over. The Health Ministry says the number of non-urgent emergency department patients waiting for beds has halved since the peak of the XBB wave. But even as life largely returns to pre-COVID-19 normal, Health Minister Ong Ye Kung says there's still a need to expand the nursing workforce. Last year, the attrition of foreign nurses more than doubled year on year to around 15%.
During the pandemic, the competition for nurses by different countries has been very intense, and we lost many of our good and experienced foreign nurses to other countries. We will need to replace the nurses we lost and further expand our nursing workforce by building up both the local and foreign manpower pipelines.
At the annual Tan Chin Tuan Nursing Award ceremony for enrolled nurses, Mr. Ong said that ramping up foreign recruitment is important to bolstering the workforce.
Of this number, there will be a higher proportion of foreign to local nurses, split about 60-40. This is to make up for the slowdown in foreign nurse recruitment due to COVID-19 border restrictions over the past 2 years.
Nonetheless, the majority of the nursing workforce will continue to comprise locals from nursing school intakes and mid-career training programs. There were around 43,000 nurses and midwives last year. Most were registered nurses taking on more advanced patient care work. Enrolled nurses, on the other hand, made up about 16% of the nursing workforce.
The Ministry of Health is working with ITE, the Singapore Nursing Board, and MOE to review the enrolled nurse training, along with enhancements to the enrolled nurses' scope of practice.
This will prepare enrolled nurses to take a greater role in improving community health as Singapore rolls out its preventive care strategy. For example, educating patients on lifestyle adjustments or recommending health screenings.
Okay, going to shift you to the chair.
This is what senior enrolled nurse Anna Goh does during an average day of work. She has spent 17 years in the neurology ward at Tan Tock Seng Hospital and cares for patients with conditions such as stroke and dementia.
I will treat them like my own family members. Then I will also every morning or every shift I came, I will greet them first and say good morning or good afternoon or good night. So they will feel more warm that they are staying in the hospital. Say, I will not feel lonely.
Ms. Goh is the first prize winner of the Tan Chin Tuan Nursing Award, the highest honour for enrolled nurses in Singapore. She is lauded for her role in contributing to a safety protocol for her colleagues and caregivers. It ensures accurate tube feeding placement in a patient's stomach. Despite her prize, Ms. Goh tells CNA that the chance to mentor younger peers is just as rewarding.
I also have the opportunity to teach my new junior nurses and then to plan their objective which they need during within the 3 to 6 months attachment in our ward.
Another winner, Principal Enrolled Nurse Rahima Muhammad Rais, helped to pioneer the Pain Management Clinic at Sengkang General Hospital. She had created a workflow for the clinic and is training other nurses there. Like Ms. Goh, Ms. Rahima echoed that a love for her patients is what drives her.
Nursing is a way of life, I would say. It requires compassion, patience, open mind and open heart. It's putting yourself in their shoes, going the extra mile.
And that distance could sometimes take a toll on nurses. Ms. Rahima says more could be done to stamp out abuse and harassment of healthcare workers. She also calls for a wider career path for nurses.
For the enrolled nurses, expand the career path because we only end at principal enrolled nurse. Why don't we expand it to senior principal enrolled nurse? It would be a better career path.
If her wish is granted, aspiring nurses here may be the biggest winners.